The AIDS epidemic, which has been rolling in this country for so many years, remains one of the biggest problems that we have to deal with. The Anova Health Institute works in a number of different areas. One large piece of our work is what we would call health system strengthening, working with the facility level, working with health managers, working with health staff.
Anova supports 78 primary healthcare facilities in the city of Joburg. So our role is to support these facilities to implement HIV, PMTCT, and TB programs according to guidelines or protocols set by the National Department of Health. In 2010, only the 7 big clinics were providing ARVs to adults and children. So we came in, we trained the professional nurses in those clinics. We went to the clinics after the training to sit and mentor them one-on-one. And at the moment, all these primary healthcare facilities are able to provide ARVs to their adults and pediatric patients.
Over the last 2 decades, there are 2 things that absolutely stand out: HIV and the impact of the AIDS epidemic, and linked to that, tuberculosis.
So we've been very instrumental in supporting the facilities to integrate their HIV and TB services. So what that means is, as a patient who's infected with both HIV and TB, I come into a consulting room, I've got a nurse who's able to provide both services, and I'm managed by one nurse for both conditions.
We're doing health system strengthening in eye care. Some of the gaps that we identified is that nurses do not know how to manage opportunistic eye infections in HIV-infected individuals, and that is what we are doing, strengthening the nurses in how to manage those opportunistic eye infections.
So one of the aspects that we've worked in from the beginning is the prevention of mother-to-child transmission. Our staff started those programs in the very early years, and it's really a huge success story that we've been part of.
Through Anova's work in those clinics, by training the nurses, making sure the mummies were tested for HIV, making sure they were provided with treatment, making sure that they were guided on breastfeeding, the transmission rate has decreased from about 12% to less than 1% currently.
I was diagnosed with HIV positive 2004, and then last year, then they introduced us to PMTCT. So I was eating well, doing everything that they told me that I must do. And then my baby was HIV negative.
So our focus now is on eliminating transmission of HIV from mother to baby and no longer prevention.
Anova Health is supporting all 125 wards in Mopandi.
This clinic is the first clinic that all of the children, and they know their HIV status. And then we come here, we talk about disclosure, we talk about HIV, STI, everything. We have been trained to work with children, so we do psychosocial support at the clinic.
And then we also have the grannies campaigns where we have the grannies together. As Mopane is very rural and it has a very high traditional belief. So we educate them about the support and about HIV and how to protect themselves from getting HIV as they are taking care of their grandchildren. It's not easy to go there to the clinic just for HIV counseling and testing. So what we do with the outreach team, we go and identify those villages. We offer HIV counseling and testing, which it helps the communities to know their HIV status.
Anova has provided this mobile clinic for medical male circumcision services to ensure that the people of this area in the Greater Tzaneen, they get the medical male circumcision. It's free, they don't charge.
With the outreach team, we are very lucky or fortunate to have a very dedicated team that does the outreaches. They are very dedicated. They can leave the office in the very early hours of the morning. And I personally, I love my job, and especially working with pregnant women, I always want to educate them to make sure that their babies, they are born HIV free.
We also work in a large program that targets men who have sex with men. So that's gay men, other men who have sex with men, pioneering program that's never really been done in South Africa for a very vulnerable group.
We've got to educate. That's the key to success, especially for young people, to make sure that they believe that HIV is there and HIV kills.
As we know that men who have sex with men are men who are actually facing a lot of stigma in the community and also in healthcare services. So we try to make sure that it is accessible for them to come to clinics and access free services without any stigma or discrimination.
Health for Men is an organization that deals with issues based on HIV and also on STI.
I'm part of the outreach, and the outreach team, what it does, it goes on location, meaning in the township, whereby we do ACT, meaning testing people and specifically men, and we educate them about the safe sex, meaning giving them condoms and also lubrication.
So we are there in full force to assist you. We are there to work with you. And also the work that we are doing is because we have passion to do that. We have passion to work with young people, and we have been in the field of HIV for 25 years.
Also in the packs, there's information about us, where you will find our clinics, and also how to access the treatment of either HIV or gonorrhea or different STIs.
We only dealing with men because we decided that the men, they don't like the general clinics because of they are scared of what they come for and what are their problems. So we've decided, let's make their own special clinic so that they can be comfortable and be treated separately. So if I've got an advanced case, I refer to the Ivan Toms. We've got another clinic that is based in Woodstock.
So they come to us because we're not judgmental. We try and address their specific needs, but also there's really a level of high expertise here. It's one of the few clinics around that's situated in the primary healthcare level, but has embedded expertise on site.
Going to the clinics looking like this is they have a stigma and they turn to be those dramatic people. So going to the MSM clinic is very convenient for me because I can be myself. Nobody judges us and they give us what we want, and that's treatment and help.
Because I know that they need my help, so I'm willing to give them the help.
And for those who are coming to collect their medication, they don't even have to stand on a long queue. They just come in and out to collect their medication.
For me, when I'm able to reach to a person and tell them about our services and also tell them about what I know about HIV and also STI, I'm able to say I've made a difference today in a person's life.
So one of the things that's important to realize about the Health for Men clinics and these COEs is that they are not necessarily the main focus of the Health for Men program. They're really one component of an overarching program, and so the health component needs to link with community engagement and upliftment and health demand creation.
So we're working in a number of fields around what is now called mHealth, mobile phone-based applications. Because everybody is carrying a phone, it reaches them privately, confidentially, and in a way that they can interact with providers of health services.
I want help, and I want to be free. I want to be out there. I want people to know who am I, what I am doing. I want to teach. I also want to teach them that if I'm a lesbian, I'm also human.
For many years, women who have sex with women have been neglected in the HIV response in South Africa because it's very difficult for women to give HIV to another woman. However, women who have sex with women are often involved with violent relationships. They are raped quite often, and ultimately they are vulnerable to HIV.
It's women who are having sex with women, WSW. They are helping us. They ask us so many questions. What do we need? What do we want on our clinic? We told them that we need protections, safety packs, we do need those. We really need them. And they have to talk to our nurses around our clinics that they should help us on things like this, because we don't get any help, much help that we do need.
Healthcare workers really need to embrace the diversity of sexuality in South Africa. This program, through training nurses and healthcare workers, can really make a difference.
Sometimes when we talk about public health, we divorce it from the people that it's really helping. So we look at numbers, we look at clinics, we look at those kind of statistics. But in the end, it's about affecting the life of a mother and a baby. It's about affecting the life of a young gay teenager who was too scared to go into a clinic. It's about providing circumcision for a 14-year-old guy so that he feels protected as he goes into adult life. That's what it's really about, and that's what we're trying to help people to do. I'm really proud of the Anova staff and the work that they do. I think that they're completely passionate and committed to their work, and it shows in the way in which they interact with government services and with clients. I think that they're providing innovative approaches that are at the interface of the health problems and the health solutions, and they'll continue to really impact on healthcare.